Let's start session 4, the final session of this review. Panel discussion 2, building now to issues of public CA infrastructure. I'm a provider Ano from NC. And panelists, I would like to introduce the panelists. Yoga Kanai from APL, and Mito Alai University, and Yoko Yamanishi at Kyushu University, Takashi Matsuba from IC. Okay, let's start. In the opening, Akita Sensei introduced the structure of this symposium. And this time, in session 4, four PM participate and discuss the following questions from Akita Sensei. First, I would like to introduce this session. This moonshot object one started at 2020, and 3 p.m. They made 3 p.m. made remarkable progress in this project, and also they overcome the many obstacles. From now to 2022, this station we already reached the station 22 stations. But after that, so many obstacles appeared, and 7 p.m. Take over these kinds of obstacles for 2050 objective. From now, they started to 2050 objective, and they overcome many kinds of obstacles. 7 p.m. are running toward the goal over various obstacles. First, body, brain, space, and time, living and social scale each year. And second, molecular and biological scale CA. And reliable and safety CA platforms. From now, the 7 p.m. start to run toward the goal. Then, I received 2 questions from Akita Sensei. Question 1, what are the main technological and non-technological challenges necessary for building now to socioscopic CA infrastructure? The second question, what are the key points in R&D for service users, operators, and service providers to create a user-oriented CA infrastructure? Then I dig down these questions into 3 categories. One is the user, second is the technology, and third is the non-technology. And many viewpoints exist in each categories, and many measurement issues exist for evaluation the project and the results. Let's start the panel discussion 2 from now. I complete the introduction, and second panelist talk the answer to the questions each 5 minutes. And after that, we discuss these answers and questions. can wrap up this discussion. Okay, let's start. At first, are you ready? Okay, let's go. Mr. Ryota Kanai from ATR. Please.
Okay, yeah, thank you. Okay, let me go to my answers. Right. Okay, your first question was what are the main technological and non-technological challenges for building nano to social-scopic CA infrastructure? Yeah, so there are several aspects to this question. And so the first one, I want to address technological challenge. So since in this question, we have a big span from nano scale to social scale. But I think what's common across all those different scales would be related to data infrastructure. So of course, with in-body CAs at the nanoscale or the millimeter scale, we want to collect a lot of data. And it also, so in my project, we focus on brain science, and that's kind of like an intersection between like biological scale and social scale. And so we are also interested in communication or facilitation of communication through neuroscience. So the communication across individuals comprise society. So but across all these scales, I think data management is going to be extremely important. And also, we also need like data science platform. So, so I believe that in all the projects in this moonshot, we gather lots of data, but also we need to establish a systematic way to derive knowledge from data in a systematic manner. So that's important. And also, we need to find ways to communicate knowledge coming from data science. So I think this part should be important across all the projects. So, and also, we often talk about digital transformation of the traditional companies, and it seems like it's going to happen, but somehow this is a very slow progress. So yes, that's one big challenge. But if we solve this, I think we will get like a lot of progress. The second one is non-technological aspect. So when I think about using in-body CAs and new project managers directly address in-body CAs. And in my case, we have a new team that works on the development of new technology to record neuronal activities from the inside of the body. So yeah, so it is like really a new kind of technology, and I think of course there's a lot of technological challenges there, but I believe it's very important to show convince people that there is a really clear advantage in using those technologies. And especially, I feel maybe this will be a really new kind of medicine. So right now, like when we have some health conditions, like there's a lot of like imaging technology, and we also have typically the intervention is very limited. We may take a pill or maybe some surgery, but I expect to see like a really new ways of treatment, and also maybe this is related to the first point, but we do have a lot more data about ourselves. But yeah, so I think we need to show how we should change our mindset, how we consider medicine in the future. And also, as I have highlighted, it's very important to establish trust, because I think most people will be very conservative. Even for vaccination for COVID, there are a lot of people who are scared of new technology. But I think for everybody is scared, this fear would be much bigger. So I think it's very important for us to gain trust from ordinary users. Yeah, and also it needs to also related to the first point of advantage, but it needs to make economical sense. Otherwise, yeah, because probably in this moonshot we will produce a lot of new important technologies, but if we can connect that to business or the real advantage, then I think we can sort of create a kind of feedback from industry so that this kind of exploration or development becomes more self-sustainable. So I think that's very important, but also difficult. Yeah, and then the third point is specific to the machine interface. So these are technological challenges. Currently, as I said, we are working on the new ways to measure brain activities, but the challenge is still there. So there's no sufficiently good methods that allow us to record from all the neurons in the brain real time or something. So that's there's clearly kind of missing point in the current technology of neuroscience. So that's real challenge. Okay, and maybe I'm looking to okay, about the second question. So what are the key points in R&D for service users, operators, and service providers to create a user-oriented CA infrastructure? This is a harder problem. Yeah, and so that maybe somehow today I felt I understood CA a bit more, but I think maybe to sort of create some sort of CA industry or something for many users in the future. I think it's very useful to have a clear definition. I know that there are already definitions, but I think it's useful to sort of refine that notion. And so also, like in my own project, we are working on the guidebook on brain test, but it might be useful to have a sort of general guidebook of CA for general users. Yeah. And the second point is again similar to my response to the first question. So I think it's going to be very important to show the merits of using CA. So I think this could come from various applications, and especially again thinking about embodied CA, and I think it's very important to show advantage beyond existing methods in medicine. Yeah. So for example, if we can easily change sort of people's sort of mental disorders from the minimally invasive method, I think that would make a huge difference. But that kind of technology may not exist yet, but it might come in the future. And my last point is it's a kind of it's a retail point. I think people may worry that maybe at some point if everyone needs to use CA to have a normal life, that might create a huge pressure. So I think this should be optional. And if the technology is convincing enough and useful, just like smartphones these days, people will adopt them. But but I think it's very, we shouldn't force people to use it. At least that kind of sort of the principle of free choice should be important for like general societal acceptance of this kind of new technology. Okay, that's all for me. Thank you very much.
Okay, thank you very much. So next talk by Alain Sensei from University of Tokyo. Alain Sensei, please.
Okay, thank you very much. Kano Sensei, thank you for kind introduction. Can you start my slide? So I will change it. Okay. Right. Start. It doesn't work. So just a moment, the slide will be prepared soon. Okay, so I should start explaining. My name is Fumishito Arai from University of Tokyo. And actually, I joined this program since August, and 2 months have passed, and I'm still preparing for this project. And before answering the question 1 and 2, I should introduce what I am thinking about. Anyway, please wait for the. Okay. Now it was prepared. Let me start. So still the title is tentative, but I'm thinking about embodied cybernetic avatar, embodied CA, and especially it can be applied for several for the health monitoring. Of course, there might be another application. So, all right. どうやって次のページに行きますか。OK。ここですか。Okay, so now it is the planning stage of this project, and as I told you, I'm thinking about embodied CA for health monitoring. And well, the process of project planning is based on a backcasting approach. And of course, the future is first forecasted based on the megatrend. And we have a good reason to tackle and solve the issue. The goal should be attractive. In my case, I focus on the megatrend of extreme population aging, and we should think about real needs and well, unmet needs, and issues are clarified. So we need to think about the technological issues, and LCE is economical, ethical, legal, social, and economical issues. And the method of how to solve the issue are clarified based on my own field of expertise. And of course, the scenario and approach is convincing. So for the planning of the project, I like to contribute to realize a safe and secure and comfortable society. To realize that, I considered about health monitoring by using embodied CA. As you can see, this is the concept of my project. So basically, a small CA, millimeter, micrometer, nanometer scale, small robot-like agent may go inside the human body and measure and monitor the condition, environmental condition inside the body. And those information can be presented to the user for the self-monitoring. Okay, to realize such kind of technology, I considered about two main projects. One is a miniaturized CA technology. This is a kind of micro nanoscale robot-like technology because body condition and its environmental information are basically unknown, and limited data and limited reachable location and actions. Therefore, to know the environmental condition in body, we have to realize small CA, which can go inside the human body. And the second one is in-body environment information and cyber physical interface. Because the data is huge and complex and diverse, and we have to judge. So cognition and perception is really difficult. So there are several limitations like recognition and manipulation of CA due to difference in scale and difference in environment. Okay, so this is especially I'd like to focus on the challenges of in-body CA for health monitoring. So for the question one, of course there are so many challenges in goal one, but in my case, there are 2 points. One is to solve the millimeter micro nanoscale CA. There are mainly hardware program and safety issue. For example, to realize a small CA which can go inside the body, mobile function is a capability in this case, and manipulation function and energy supply, actuation, operation between CAs, sensing capability, of course, how to fabricate and assemble those small CAs, and that CA should be made from the biocompatible material, communication, drug delivery, transportation, evaluation, safety, reliability, production methods. There are so many challenges. And the second technological aspect is in-body environment information and the cyber physical interface, how to visualize the measured data and how to display. Of course, interfaces and teleoperation is also important, and personalization, database communication, how to control those CA and interface evaluation, the forecasting, how to give advice, authentication, privacy, safety issues. So there are so many technical challenges. And the second question is key points in R&D. So Kanai Sensei explained, and I fully agree his comments. And here I'd like to focus especially in a case of in-body CA. So such kind of diagram is very known. And there are many technological or non-technological challenges to make the technology commercialized, right? And there are several areas like David Riddle and test battery or DC or something, right? So how to overcome those problems is, of course, key points, right? And I'd like to focus my key points in my R&D. And here I'd like to say about 5 points. The first one is the confirmation of safety and effectiveness and keep potential users, because in-body CA is used inside the body, right? So this is the real, characteristics of this technology. They must be used inside the body. That means they have to be safe, okay? So, for example, thinking about safetiness of in-body CA, there are several questions. For example, how to obtain the biocompatible material. To realize such kind of safetiness, there are several barriers. So I think about the 3 main barriers. For example, risk of the company, it is difficult to preserve the safetiness of the product in general. Who will guarantee the safety? And afraid of failure and lawsuit and harmful rumors or something like that. So to overcome those barriers, I think it is very important to prepare a strong recommendation by, for example, medical doctors with scientific reasons. So such kind of basic research is very important. And the second one is a little benefit to the company at the first stage. If the business is not so profitable enough, the company will not cooperate easily or reluctant to start immediately a new business. So development of a niche market and define a good user and economical aspect, not too expensive. That is very important, and no risk in cooperation. The last one is approval thing of the InBody CA. So in Japan, we have to care about the PMD Act. And however, it takes time and cost to get approval. So safety must be firstly confirmed, and we have to find user, right? And usefulness and potential users are very important. And merit advantage must be clarified. And of course, economical aspect is very important. If the price is too expensive, nobody uses it or something like that. And social aspects. There are several social aspects. And of course, there are several points, key points in R&D. For example, second part is prepare a good simulation environment for reducing trial and error testing in R&D process and for evaluation. Because InBody CA is used inside the body, so safety and usefulness is the first issue. So how to evaluate it? Of course, we have to use animal test or cadaver test or something, but it takes time and cost. So I have studied about bionic simulator, bionic humanoid, that is a kind of human simulation system that can be prepared using cyber-physical technology. Of course, this technology might be not a core technology for InBody CA, but such kind of technology or evaluation environment is very important. And of course, that is basically based on the artificial system, but their biological cell might be integrated together to simulate, and such kind of environment will accelerate our R&D process. That is very important to efficiently pursue our project. And there are several points, but the time is limited, so I may just read it. And the third one is a good application software, of course, to get the public acceptance of new technology, increase interest to people who may don't pay much attention to this for our own health. So good application. The fourth one is make a system which can collect personal data automatically and easiness is also very important. And prepare a big database considering the privacy, of course, and protection of personal data. And the last one might be the most important part. Technology alone cannot solve society's problems. So policies, such kind of regulations and systems will be designed and run together. Okay, thank you very much.
Okay, thank you very much. The next talk by Imanichi Sensei. Please.
Thank you very much. My name is Yoko Imanichi from Kyushu University. I'm going to answer the Hakita Sensei's question. Same as Professor Arai, I'm just started the project and it's under construction. So my answering the PowerPoint is a little bit just a moment. いいです。はい。はい。So my cybernetic avatar is inside the cells. The title is Realization of the Society Where Everyone is Stood by Remotely Controlled Avatars Within Cells. So same as Professor Arai, but it's in the body, in something out in the body, but in the cell. So it's more in a smaller scale, from the micro to nano scale. So the question to answer, number one, what are the nanotechnology and non-technological challenges necessary for building nano and socioscopic CA infrastructure? So I just try to answer the short answer in terms of the non-technological issues, the technological view and user view. First of all, as Professor Arai said, the technical point of view, we are targeting is a nanoscale. Therefore, it's the scaling does matter. So technology is not it's not solve the for example, the response time and the when it's triggered, it's quite takes time to under the nanoscale environment. So technical point of view, most important for the nanoscale, microscale technology is to overcome the time scale responsibility. But we are trying to find out the new time scale for the nanotechnology. So need to be simplified the system and also to design what is the most important for this environment to create the most effective response time. So, in case of the technical point of view, apart from technical point of view, non-technical technical issue is because it is invisible. What is going on cannot understand to probably the society people. So it is quite important to society, social acceptability due to its invisibility. So in order to understand what is going on, you need to appeal to the medical doctor or the society who are the user for this cybernetic avatar within cells. So we need to convince people for this technology. This is important for non-technological issues. So in case of the user view, end user's view is probably because it's probably invisibility. Sensory rejection to the intake CA is probably may happen in the future after the development. And also, in case of the operator's view and the productor's view, it is in order to intake or to accept this cybernetic avatar within cell, it is important to remarkable benefit provision, provide the remarkable benefit and the high throughput operation, and also low in risk is quite important. So safety treatment and many testing for the safety, and also quite impact for the remarkable benefit for this using this cybernetic avatar within cell is quite important. So for example, the future, I'm sorry, the future is for example, the high production. How are we going to produce this cybernetic avatar within itself for high production, and also with safety, and how we are going to the users to accept to use this cybernetic avatar, and then after the cell is making the active to the others, and then it's going to detection the internal conditions and teleoperation, and improve the physical condition, and then again the teleoperation. This kind of the thing is quite local social accessibility due to its invisibility is quite important. So the second question is, what are the key points in R&D for the service users, teleoperators, and service providers to create the user-oriented CA infrastructure? So I was thinking yesterday about what I should answer this question. But still we are under development, and I have to answer again for this question about the social accessibility, adaptability, and to use this CA for the users, operators, service providers. For example, in terms of the user view for future 2050 or long and far future, maybe we maybe have when it's going to make an illness, we may go to the drugstore, or we may go to the hospital, or we may go to the personal medicine treatment may going to be treated, but this certain powder will try to create the precise personal medicine and provide many benefits for this cybernetic avatar. But the important thing is how we going to appeal to this technology to the society, and how we are going to reliable attending physician for the first step to convince people, or how we are going to appeal to society is under development, and we are thinking about this is the most important point to this project. So this is the answer of my question. Thank you very much.
Okay, thank you very much. Next, Matsura Sensei from NICT. Please go ahead.
Okay. Thank you for your kind introduction. So my name is Takeshi Matsumura from NICT. So NICT is the National Institute of Information and Communications Technology. So yeah. I'm a newcomer of this project, so it's my great honor to join this project and with these big professors. And my project will take responsibility of the infrastructure. So infrastructure for ensuring the reliable interaction between human and the cybernetic avatars. So after joining in this project, so my thought has been stuck on the how to develop that kind of high reliable infrastructure for the CA applications. So that my answers mostly from the viewpoint of the technological challenges. And so first, so from the viewpoint of the communication challenges, so I have three answers here. So the first of all, so anyway, so it is necessary to clarify performance requirements for each use cases from the nano to socioscopic CA applications. And also it is necessary to find out which part can be shared among the CA applications. So interface, protocol, middleware, and so on. So we need to discuss about these things with other professors. And also, this is a kind of question for the Yamane Sensei and also the Ai Sensei. So non-CA, so embodied CA, of course, we have the many restrictions. So Professor Arai includes communication as one of the challenges. And also I have the very kind of thoughts about the restrictions for the embodied CA. So because it has many restrictions about, so for example, the manipulation, battery, and also the biocompatibility. So especially for the battery, so maybe the such kind of field does not require the battery, so don't want to have the battery. So but battery-less CA, so this means the communication field, so communication area, so we cannot use the active devices, so passive devices. So this very much leads to the applicable communication system. And other challenges, so these are mostly from the technical point of view. And so I think it is necessary to organize the different common senses among the CA applications. So not to miss the functional implementation and sharing. And also it is necessary to consider the limit of communication and how to provide from both fields of CA system and infrastructure. So especially you can understand the wireless communication cannot achieve 100% error-free communication. So that we need to think about such limitations during this project. And also, so against these answers, so I think it may not be necessary to develop a perfectly common platform in any CA application. So, because I think the nano and social CA systems maybe need a different coverage, of course. And also the unified platform will be costly. So that we need to classify classify these points from that point of view. Okay. And the second question, so this question is asking the key points for the user-oriented CA infrastructure. So yeah, and again, so from the viewpoint of the communication infrastructure, so it is necessary to clarify the desired input and output to the Cyber Capital platform from the service user, teleoperators, and service providers. So yeah, this is my question for this counter question. So what do they request to the CA applications via the CA platform? And also what do they need to receive from the CA platform? So we need to think about these answers or these questions, and so we need to apply the kind of feedbacks to the highly reliable infrastructure. And also we need to have the contract about the mechanism to detect difficulties and continuous operation connection to service provision so quickly, and to provide alternate technologies if possible. So this kind of interface should be standardized during this project. And in addition to these answers, so I need to consider about the safety. So safety means so maybe so we can pair the CA and the human, so operators, by using the kind of authentication procedure. So yeah, it's okay. But even if we have the strong authentication procedure, but so maybe some operators will have the malicious intention to operate the cyber avatars. In such a case, so we need to provide such kind of operation in our infrastructure. So maybe this is an important point for developing such kind of CA-based society. So that's it for my answer.
Okay, thank you very much. Okay, so for PM provide the answer to the questions. But so many subjects and many ideas exist in their presentation. So it is very difficult to integrate the single project, so your CA, so as a result, should become infrastructure, and finally, so become utility in the society. So if you pick up the one subject to realize the CA as a utility or infrastructure, so please pick up the subject or TKS goal to be broken. So please, just I require only the personal opinion or personal comments. Okay. So this viewpoint, this is there is a three viewpoints. So please, in each viewpoint, please pick up the most important or biggest goal in your project. Your research and development activities. So, Anai Sensei. Okay.
Okay. So yeah, from my viewpoint, as I briefly mentioned, the biggest challenge is to establish a new way to measure brain activity. But usually neuroscience is electro. But from this presentation, I have like a lot of expectations to encounter new technologies. Neuroscience is unaware of. So yeah, or maybe it may not be in your current project, but maybe through interaction, I hope to have some like new approaches. Because right now we are really limited by our ability to report from the brain, especially from the inside. So yeah, that's a challenge, and I hope to have like more interest from experts.
Okay, thank you very much. Next, I can say, you mentioned very good pictures and radio this valley now with the sea. So, as I said, to overcome these kind of obstacles. So, most difficult subject.
Yeah.
What is the most difficult subject in your project?
Yes. So actually, all one focuses on embodied CA. So embodied CA, as I told you, small agents go inside the body. Depends on the place of the body, the difficulty might be quite different. For example, under the skin or inside the gut, gastrointestinal tract, or inside the blood vessel, under the eye or near the brain, quite different. Okay? So actually, my interest, I'm now planning about embodied CA for the gastrointestinal tract. Right? So to put something inside the body and see inside the body, it's quite different. Nobody knows what's happening in my gut. Everybody has a gut, right? But nobody knows what's happening really inside the gut. To know it, it's scientifically great contribution, and of course, the most important thing is like casting, and we have to consider about megatrend, right? Megatrend is a kind of aging population. So everybody, gets old, and we are conscious about the health, own health. Right? So we'd like to know what's happening inside the body. To do that, maybe many people are interested in, but they are basically reluctant because safety is not clear. So the most challenging is safetyness and of course usefulness. Okay? And it depends on the types or function or capability of embodied CA. So in our case, the time is quite limited, so we may focus on some specific program, but embodied CA, as I told you, depends on the place and depends on the application. The required technology is quite different. But I think for the 2050, we should think about the basic technology. And the science is very important, of course. But in the same way, we should think about the real application, find a real user. What is the unmet need? What is really required? And based on such kind of existing users, we should clarify the program clearly and think about real needed technology and think about the priority, right? And focus what is necessary, what should be discussed, taken as the first or something. So in a sense, safety and of course usefulness and of course the topics should be clearly challenging. Yeah. That is in my case, in my opinion.
Okay, thank you very much. So next, Yamaguchi Sensei. So your research is very emerging and amazing technologies. Very small CAs inside the body. So repair or check your health, human health. So this is a good idea and good emerging technology. So if your technology become the infrastructure, so not only social but also body infrastructure. So what do you think the biggest role or biggest subject in your project?
Infrastructure, in terms of the infrastructure. It's a big issue. Probably, in terms of technical point of view, because it's quite tiny, a nanoscale thing. So we need to the time scale and the response time, and many things is actually very it's quite difficult to diagnose or the cure or to keep the to keep the body precise healthy condition. It is very important to first of all how much amount of the CA is required. We need to do some kind of the standardization and also to make some kind of the guideline to use to how the categorize of which kind of the CA in which itself is required, what's kind of the technological, in order to, before we use, we need to do some kind of the standardization and make a rule to use.
Okay, thank you very much. So next, so you are almost an infrastructure technology expert. So what is the name of your technology? The current wireless technology, IP, and already several beyond IP projects already started. So what is the name of your wireless technology? PC, 7P, 8P.
Okay, so anyway, so first of all, so maybe the CA providers, vendors, and also the vendors, so require the practical infrastructure. So maybe the emerging technology, new technology, so cannot be easily applied to the CA infrastructure at present because it is not think currently, so we need to apply the current technologies, but new technology about the 5G, so the CA infrastructure. And the technical challenges for the infrastructure, so especially in the communication or network infrastructure. So it is important how we should manage the whole network, including the wired and wireless networks between teleoperators and satellite operators. So because most part of the wired network difficult to be controlled. So that but advanced satellite operators require a very low latency and low jitter. So that as well as the other technology, for example, the autonomous driving cars. So I think it is necessary how to satisfy and maintain this requirement in the whole network, including the wired network, and from the various viewpoints. So that I say we need to clarify the actual requirements for each satellite use case.
Okay, thank you very much. So this talk also various kind of issues in the talk. So the next question is what kind of state of the art to be over? So state of the art means the program statement unique structure. So most of technology is forecast and improving the performance, improving the size, improving some energy consumption. But this time, so we should make some tests. What is your state of art for test in your project? So from now, so I'd like you to raise hand and really discuss. And you can break the talk and make a new question. Okay, please raise it.
Okay, so from the viewpoint of the infrastructure. Yeah. So I think, of course, the satellite cloud applications will be extended to the extreme environment. For example, the outer space or undersea. So the Professor Shishia introduced the undersea robot in her presentation, and I'm very excited about her presentation. But I can say so, unfortunately, it is controlled by using the wired connection, I think. So, and maybe I think she wants to have the wireless communication with the robot and the operators. But, so in such an extreme environment, so for the wireless network, also the severe challenge, also has the severe challenges. For example, the outer space, of course, it can see the target device, but the distance is very long and it induces long delay. And also the underwater, so we cannot see the target device and it is difficult to have the long range communication. So this kind of challenges we need to solve for the C applications extension. So this is I think kind of most important challenges for the future CA-based society.
Okay, thank you. Okay, I have a question to everyone. I have very related to that by industry, but I have kind of ambitious ideas. So one is whether you think it's feasible to connect like nano or micro CAs to the network directly, like to the like 5G, I don't know. But I think it would be really interesting. We can directly constantly monitor what's happening inside the body through some network. And yeah, does anyone have any thoughts?
So, can I say this is a very difficult question? Anyway, of course, it depends on the application, but the important thing is, well, a kind of system integration approach. There are so many available technology and some part is missing, but to solve some specific problem, one technological field is not enough, and we have to unite many different kinds of technology. So I think networking is quite important. Therefore, small projects have a limitation to solve such a very complex problem. But as you said, from nano to social is a really wide range, right? And quite multidisciplinary. There might be, knowledge of the medicine or biology, material science, information, robotics, whatever. So it's quite, wide. But the important thing is networking. We have to find the proper people and make a good team to tackle those problems. Yeah. And of course, technology itself alone cannot solve the complex issue. So, united group, including policy, social science, is also very, yeah. So it's a general. Yeah.
So, can I say that very difficult to me, I'm thinking, but the nanoscale with the scientific evidence in within cells is have a problem in the needing for data is all right for the part responsibility. But in case of our case, is probably, for example, output is to measure the change in the people compound in the body. This kind of small change have to be output. But the time scale is because the nano level diagnostic is quite little bit in the time probably to amplify to the output. So the thing is, after that output will be made on the network. The thing is, it's the time scale is probably different, but it's kind of the trigger in the output. That's the slow scale. But the thing is, it is important to think about the nanoscale, time scale, output, and the network.
Yeah, so I have the same question actually. So the point of the wireless communication, yeah, it is very difficult to completely support the in-body wireless communication. So as already made, so it should be the timing so that the small battery can be implemented. But so many applications don't want the battery. So in such a case, we need to implement the touch device. But the higher frequency has high loss for the in-body. So that we won't use the lower frequency one. The lower frequency one induces the big size device. So the very difficult challenges for the in-body. But I have a kind of capsule type communication device so with tiny camera, and it can transmit the image from in-body to the outside. But I think it cannot operate continuously. So maybe I think or some kind of in-body phenomena stimulate the device and then so transmit the image to the outside. So that I think maybe the professors want to have the manipulation type in-body devices so that still we have the challenges for realizing such kind of applications. Yeah.
Okay. So can I? So especially Yamaguchi Sensei's CEA is very small, non-scale. So current or previous communication technology need digital computing function and radio frequency modulation and demodulation functions. This is a current communication technology, basic communication technology. But in the case of now CA, I think or I expect the new type of communication way to be appear. So that is, I expect in one instance, innovate the new type of communication way, including the non-scale CA, CAs and non-scale CA and teleoperators. I expect.
Thank you very much. I will try my best.
Please collaborate with Matsuura. Okay, any other comment or talk?
Yeah, I want to add something. So the reason why I asked whether you can connect the small in-body CA network is because in my project, we are trying to record EEG when people are just having normal life. So like EEG on the train or on bicycle, just walking on that basis. So in principle, it's not difficult, but with this kind of setting, we seem to be able to observe new sort of relationships between vocation and maybe brain state, or like weather, or maybe temperature, and then we can make comparisons. So, but then I think similar thing can be done with in-body CA when you receive a lot of information from everyday life. So that kind of possibility is very exciting.
Okay, thank you very much. So it's okay. Please next. Let's move to the next subject. What do you think the best way to realize personal and social acceptability? So, Kanai Sensei made many activities in this issue, or in this issue. At first, I would like Kanai Sensei to introduce some activities for your CA's acceptability. Okay?
Sure. Yeah, so in our case, we have been working on the so-called guidebook of brain technology. And so there are two purposes. So one is to explain what brain tech is in a simple language. So because maybe unlike in-body CA, there are already products which you can buy on Amazon. Then you can record your EEG. But sometimes people may have too much expectation, and so what's claimed by the product may not be correct. So in that sense, we wanted to give some guidance so that people can understand what's possible and what's not possible. So and also we are collecting evidence. So there are already many academic papers that did some experiments. So we do meta-analysis of published papers to evaluate whether typical claims are true or not. For example, people associate alpha wave with relaxed mental state, but actually we don't know whether it's really true or good measure. So we have we use a group of people to evaluate. That's sort of a common myth about neuroscience, and then try to evaluate. So I think that kind of communication from scientists plays an important role to gain trust. I think that may not be sufficient, but I think that's something we are working on.
Okay, thank you very much. So by Kanai Sensei's talk, so I think
yes, yeah. Well, acceptability point of view, first of all, the functional capability of the system or service should be clarified, including safety. And I think that people who, under that condition, I think that people who have a strong motivation to utilize that function, I think if it is safe and economically acceptable, it can be used. However, if the motivation is very low, then it might be very difficult to spread such kind of technology. So in that sense, we may firstly consider about, of course, unmet needs and exact users, and clarify the functionality, capability, and content of the service or something. Then focus on required technology, and of course the roadmap. That will be very important. Yeah. Okay. And like a smartphone, if it is commercially, easily acceptable, obtainable, then people start using. Therefore, as I told, good application and good database, and how to utilize such kind of database, such kind of social structure is also important. But that will be the later phase. Yes.
Okay, thank you. Yamagi-san.
Yes, the question number 3. Yeah. I think this way is a strong impact, strong benefit compared to the conventional relative technology. That because I think the people still hesitate to start to use phase is quite difficult. And standardization and make a guideline and appeal to the society by using the kind of the workshop or conference is it takes time, but it's the future is in 2050. We need to something to make the specific application to convince people to start to take that commercialization product to start to use. That's the trigger need to benefit, I think.
Yes, so I will give you from the viewpoint of the safety. So as I said, the safety is important, and we must worry about the safety about the CA itself and also the CA-based new society. So I think we cannot completely reduce the accident about the CA as well as other technologies, of course, the plane, the car, and so on. And so if such kind of accident happens, so who can take a responsibility about the accident? It's very important. Of course, so my responsibility is reliable infrastructure, and of course we need to minimize communication error. But even if we achieve the error-free infrastructure, but in sometimes so maybe the CA will do the unexpected operation. In such a case, we can't take the responsibility. So I think we need to make the effort to minimize such accidents and also establish some rules for regulations. And so fortunately in this project, so a variety of field professionals are involved in this project, and we can, I think we can make some kind of rules or regulations during this project.
Okay, thank you very much. Well, 5 minutes remains. So, this is the final conclusion, and I would like you to message, like, do you have support or support request to, do you have any support request, additional support request to government, JSC, and Access. And please talk as a briefing from Hanai-sensei.
Okay. I think like in the challenging project like ours, we have to. So one is So to make the output of the project successful, I think we need to connect that to applications. But it's I want to have like more support to create some sort of rule about this kind of transfer of IP to industry or companies. So I think more discussion about the system for this transfer would be very helpful. But I think maybe it's also related to maybe as we have a more concrete product, I think like ethical consideration or maybe like legal regulations become a real issue. So I think that's where additional support would be helpful.
Okay, thank you. So other 3 p.m. just the program project is just started. So if you have some request to government, JSC, and
okay. So actually, it is still a planning phase, and for me, now it's most important thing is the networking. And to solve some challenging topic, group formation is a key issue, right? And we'd like to find a proper partner, right? Members. And now it is the most important phase for my case. But after continuing those projects, maybe necessary partner will be changing, right? So for this time, it's a very good opportunity to meet everybody face to face and exchange information. That is a very important opportunity. For example, I did the impact project 4 years ago, and once I did the exhibition at the big site, and one private company visited my exhibition and interested in commercialization. And I'm still keeping collaboration with that company. Such kind of networking opportunity is very important. And online stage communication has real limitation. Therefore, in future, I think it's very hard work to prepare such kind of big meeting, but it's really important to meet each other and exchange face to face with any level of people, including students. Yeah, that is my request or asking.
Thank you.
Okay, so anyway, so I'm very exciting, so I can do this project. And so maybe I'm not so familiar with the CA field. So my background is actually very close to the Professor Sensei and also Professor Hanai, but still I'm not so familiar with the CA. So so JST and also the Sensei, so please share the new information about the CAP kindly, and please do not rush us to learn the CA by yourself, for example.
Okay, thank you.
I'm very thank you for the to make me to join this motion. And I actually to getting used to how to create the project team. This is actually the first time to do such a project. The thing is, I would like to actually get more information about the ENSE, the triple ENSE. To make, I would like to make the team for the, for example, for the patent pool, patent team, and also the guideline making team. I would like to exchange the other PM and also the JST Risk team to collaborate to make the right way and short time to produce the nanoscale CAE within cells to make the next to quicker to adapt to the society.
Okay, thank you very much. So, as a conclusion, I have a message. So, do you hear Omoi? So, Omoi, that is a virus of cancer. So, Omoi means not only interest, but also emotional, splendid, and unexpected, or exciting. So, not only an interest. So, I expect 7 years will make Omori society through CS. Thank you very much.